Okay, so this video is going to be just a somewhat simple way to use a stretching strap like this. You may also use a thicker TheraBand, but the stretching strap or a piece of rope or something more rigid is going to work a little better probably to help guide spinal mechanics, specifically of the thoracic spine or in the rib area. So looking at flexion, extension, when we're kind of stuck in a certain position or have difficulty articulating a certain way, this can help to guide. You really don't want to think about it as forcing it, but really more so giving feedback so that your brain, your body can kind of activate the necessary little muscles in there to figure it out and kind of nudge things in that direction and kind of reconnect with those muscles. So you can do this sitting, standing, any way that you need to start, and then hopefully be able to progress it outward from there. So I just kind of find an area where I think, might be a little stiff, stuck. Now, most people in this area generally get stuck flexed, which means the vertebrae are pushed back in that area. And if it's rotated, it will be pushed back more on one side than the other. So it'll make it difficult to come across the body. If that side here is stuck, it's going to have resistance and difficulty going there. And it might excessively flex as I do that. So I want to keep my trunk kind of straight, and I want to be able to rotate as I come down and across. This would be flexion with a bias flexion on the same side that I'm flexing toward, and more of an extension on the opposite side, so keeping that chest up. That's what I'm going to use the strap for here. You can also go into a more of an extension bias here, so I'm dually extension or doubly extending on this side here as I come up and across. So when I sit, if that's where my trouble is, I can start there. Or if I just don't want to compensate too heavily with my hips, this kind of locks everything out there. Now if I stand, I can do the same thing, and I can even tie this with walking, bending, and other things. So for rotation, I'm going to want to try to go into a stride here that's ideal, and I can go here. I want to sit into that hip, make sure balance is good enough to do this, keep that chest out, especially on the target side, and then coming across there. So I just kind of that way. All right, and if I'm coming up and across, get lower so you can see me, but you can stand coming up and across that way. I can do it with the same side leg as well. Focus on that part, and you might feel that better. And then the other thing is I can actually crisscross here, so I can stabilize here and say, if I want to connect, maybe I'm having difficulty, problems with limitation on this opposite shoulder, but maybe it's actually coming from this side over here. And so that can be a tricky one, and that can help you to connect those two pieces of this arm, shoulder, with this side, ribs and back. And maybe you can feel that better, how the release and the movement of the one helps to facilitate reaching movement. Then you take off the strap, say you were limited with reaching behind your head, and then you can reassess and see if that's better. So it should be. Same thing, reaching down, we can do the same side leg instead of coming across. And so here, this would be flexion. So if I'm trying to extend, that would be same side coming up that way, or opposite leg that way would be my extension piece. But if I'm switching arms, I'm flexing, let's see, I'm extending here, but maybe I'm flexing on the other side. So, you can mix and match these things, but that should help to guide the mechanics once you've been able to kind of decide or determine which ones are limited and how.